This is Needy and Normal. I'm your host, Ashley Levering, mom, wife, and life coach. After years of experience and learning from my own life, one thing is clear. Meeting your needs is essential for living a better life. No, you're not needy. Having needs is normal, and your needs matter. Welcome back to the Needy and Normal podcast. I'm so glad you're here today to listen to a very valuable conversation between myself and Dr. Robert Smith. Welcome to the podcast.
Thank you. Appreciate the chance to be here and talk with you.
Yes, absolutely. So there's so much to you besides the newest thing that has happened in your world, which is releasing. This isn't your first book, but you released a book in March of 2025. It is available now. With that and a little bit of your background, would you please introduce yourself?
Sure, Ashley. Bob Smith is my name. I go by Bob, not Doctor. I grew up, hoped that I would be an athlete by my father. He thought that was what I should do and be a professional athlete, and he could follow me around to go to my games. That didn't work out. I did okay, but it certainly was never big enough or good enough to get into professional sports. With that, I ended up in medicine. Now, my father was a GP, so there was some influence there as well. But I then went on into medicine, practiced then for almost 10 years, actually. And I then realized how inept I was at caring for people with mental health problems. I'd not been trained in it. And long story short, is I then went back and got training at the University of Rochester in upstate New York in so-called biopsychosocial medicine. And I also did some inpatient psychiatry, psychotherapy, and many other attributes of psychiatry, but I'm a primary care doc, not a psychiatrist. And after that, then I've been at Michigan State since 1985 and committed to developing methods for providing primary care mental health and also for teaching it to primary care doctors. And we've done several randomized controlled trials. And so these are among the only evidence-based methods for this. And what has happened, I and many other people feel like I do, so I'm not the only one saying this, but mental health in the US needs to be improved. But medicine hasn't done anything about it. And we can talk more about that as we go. But the result for me is that I got, in spite of all the academic work that we did, and other people as well have been telling medicine needs to change, medicine doesn't do anything about it. So I decided to go to the public. This is what I'm doing. That's what Has Medicine Lost Its Mind is about. The public needs to be informed of how bad their mental health care and, in fact, their physical health care is, and they simply don't know it. And so that is kind of where I'm at and why I'm here and why I've written this book. The public needs to get informed and then encourage its politicians to actually do something about poor mental health care.
Okay, I hear you. Thank you for that. And I know like you said, we can get deeper into what you explain in your book and what you reveal, it sounds like. So you're on a mission.
Oh yeah, no, it's heartfelt. I'm retired. I could be sitting around eating bonbons, but that's not me.
You're definitely on a mission then. So you use the word fix quite a bit. So tell me, if you could snap your fingers, and I know this is a big question, but if you could snap your fingers and fix the medical industry and change it for the better for patients. I know you're very centered on patient care and the patient experience and patient communication, but if you could snap your fingers and it looks the way it needs to look for people to truly benefit from the healthcare system, what would that look like?
Yeah. What would happen, and this is what's in Has Medicine Lost Its Mind? We need to begin training primary care doctors like myself in mental health care. Not to make us psychiatrists, but simply to make us as competent with mental health as we are with physical diseases like diabetes. And we aren't right now. And so if that were done, this would go a long way towards solving the mental health problem. Here's why. People like me, primary care docs, are providing 75% of all mental health care. But medical education forgot to train us for this job. And it's just a disaster as a result. I mean, there are something like 48,000 suicides a year. Half of these people see their primary care doctor within 2 to 4 weeks of the time they commit suicide. But these doctors aren't trained in recognizing it or doing anything about it. And so if they were, upwards of 20, 25,000 people could be saved, but doctors aren't trained to do that. The prescription opioid epidemic is another example. There's still like 15, 17,000 deaths per year from opioids like OxyContin or Vicodin that everybody knows about. Doctors who are not trained in their use and are not trained in chronic pain for which these drugs are used are prescribing these, and they're not trained in this. And if they simply were trained, you could prevent all those deaths. And it's big time, Ashley. There have been over 200,000 deaths from opioid overdoses prescribed by untrained medical physicians. That's got to stop.
Wow.
But medicine doesn't do anything about it. And so that we're talking there in the tens of thousands of problems, 48,000 and so on. Let's talk now in terms of tens of millions of problems. These are the people, and there's about almost 100 million people in the US with a mental health disorder. It's the most common health condition there is. So what happens when these diagnoses aren't made and treated? Divorce, job failure, school failure, addiction, homelessness, incarceration, and on the list goes. This could all be ameliorated. You certainly aren't going to prevent all of that. I'm not saying that. But you could certainly get a leg up on all of those if you at least recognized the problem and treated it. And many of them indeed could be prevented. And so it's just a national disaster, what we're looking at. And somehow people haven't been informed of this. They don't know what's going on.
That sounds very scary.
It is scary, yeah. No, in fact, I often warn people this, what I'm going to be talking about is frightening.
Mm-hmm. When you say they're ignoring it, they're not doing anything about it, how so?
Yeah, the data speak for themselves, and I'll give you that. Here's what they do to ignore it, and this hasn't changed in 100 years of medical education. Even though mental health problems, as I just mentioned, are the most common health condition doctors face in practice, they're more common than heart disease and cancer combined. So here's the most common health condition doctors face in practice. You'd think they would train doctors to take care of these, but no more than 2% of total training time in 4 years of medical school, 3 years of residency, no more than 2% of that training time is addressed to mental health problems and other psychological and social issues and emotional issues. And so the only supervised training through all of this 2% is a 5-week rotation in psychiatry in the 3rd year of medical school with patients completely unlike those they will see in practice, which are typically very severe psychotic people, severe addiction problems, just refractory personality disorders of the sort that you'd never see in practice. It's the kind of thing psychiatrists take care of. And so, but even though that had an impact, that's just the 3rd year of medical school. There's 3 or 4 more years of training and it's washed out anyway. So that is the prime example of how medicine is simply ignoring the mental health care needs of the society.
Wow. You must have years of experience seeing this. Is this
Oh,
per is it personal as well? Has it hit home for you, or has it mostly been throughout your experiences as a educator and a researcher and a doctor?
no, this and my personal experience with it is how I got into this.
Mm,
I mentioned I was in practice,
hmm
and I trained in a tertiary medical center, which was all just steeped in physical diseases and rare diseases and the like, and I was really good at it. And so I went into practice thinking, man, I'm going to really be hot on this stuff. Well, so many of my patients did not have these interesting physical diseases. But instead, they were coming in with mental health problems, depression, addiction, anxiety, panic disorders, the like. I didn't have a clue of what to do with them. And one patient in particular came in. It was a sad tale, and it turned me around, albeit very slowly. Uh, she'd been referred to me. I was only like 30 or so at the time. I'd just gone into practice. She had metastatic breast cancer. It was all in her backbones, and she had terrible back pain. Um, and she would say things like, "Why am I crying all the time? What are we going to do about this?" And she'd already been informed previously that there really wasn't any treatment left. This was back quite some time ago when treatment was not near as advanced as it is now. And so, when am I going to get better? She would say. And what are we going to do about it? And I froze. I didn't have a clue of how to address this. And all I would do is do something like order another lab test, understanding that it simply gave me something to do and her something to do, that it wouldn't do any good. Um, and so it went on multiple visits. She wanted to be seen every time there was a problem and didn't want to talk my phone. And so I would do this. And she was a nice woman, very nice. We had good conversations when she wasn't in pain. But I have to be honest, I was relieved when she died. I was just relieved. I no longer had to deal with the stress of not knowing what to do.
Mm.
It didn't last long because 2 weeks later, after she died, her husband came into my office kind of surreptitiously, the nurses had let him come in. He said he wanted to talk. He came in and put a little book down on my desk and ran out. He said, on the way out, he said, I think you might want to look at this. I thought it was kind of funny how he came and went so quickly. And I looked at the book and I understood. It was just replete with comments she had made, his wife, before she died, in her diary. The young doctor doesn't seem to know what to do with me. The young doctor just orders a bunch of tests that aren't going to do any good. The young doctor doesn't seem to care. I wish he'd show more interest in me. And that was just on one page, and there were then multiple pages after each of our visits of this. And I was destroyed. I could hardly function the rest of the day. And the next couple of weeks, it was bad, just getting through this. But eventually, I got to the point where I started listening to patients better, paying more attention to them, hearing their emotions, and so on. But even then, this is now over 5, 6, 7 years. But even then, I still didn't know what to do with depression, addiction, panic disorders, and the like. That's why I then went back to Rochester and got training in this, and why I've been in academics since then, so that I can train primary care doctors not to have to go through the experience I did. And believe me, when I was in practice, that's not a unique experience to me. You talk to other primary care docs, they'll tell you the same thing. They don't have a clue of what to do. And quite frankly, they, like I, tried very hard and worked very hard at it and do have some success, but just there's they simply aren't trained. It takes as much training in mental health care as it does in medical care. And medicine, at sometimes they'll say, well, we do things about this. We give lectures on suicide and we give lectures on pain. and on depression. But notice what they're saying. Lectures. Lectures don't cut it. They're important. It is important to have a knowledge base. Of course, you need to understand about suicide and depression, but 90% of the learning is supervised care with actual patients with a condition of interest, suicide, depression, anxiety, addiction. That does not happen in medical school or in residency training. There is next to no supervised training. And that is the problem that medicine has failed to address for now over 100 years.
Wow. What a punch in the gut to wake you up, medically speaking, but as a human being, to
Oh, yeah. That
to
was it. As a human being. Yeah,
okay. Yeah, to see how other human beings are being treated, and
that's
so
right.
I think that's what drew me to you when I learned about your book was that this is all patient focused, your mission, and
Yep.
communicating better and reading them better in order to
Yeah,
treat them better. And so
that's right.
what I'm hearing, and I think you mentioned earlier, half of the patients who commit suicide have seen a medical
That's
professional.
correct. No, that's correct.
And like you said something, I don't want to mess up your words, but more recent to right before they may have committed suicide. So someone could have caught that.
Alcoholics, severe alcoholics, are a high suicide risk population. It's been shown that about half of these see their doctor in the 2 weeks before they commit suicide. It's just
Wow.
suicide in general, on average, about half of them, I think the figure is like 49%, but about half of them see their doctor in the month before they commit suicide. Now, if the doctor were trained, and again, doctors are not bad people. They are not deliberately ignoring this. They just aren't trained to do it. But if they were trained, they would sense a risk situation. They would ask how the patient is doing, what their emotions are, get to some of the mental disorders, because most of these people are depressed, anxious, drug addicted, and find out about that. And once you get that, and it takes a little bit of time establishing a good relationship. You don't just ask somebody, are you thinking of committing suicide? Nobody's going to answer that.
True.
But once you've established a relationship and you're making a diagnosis of depression, you broach the topic. Have you thought of harming yourself? And so on. There are specific ways to go about this. But doctors simply aren't trained in doing this. And it's unfortunate. Many lives are being lost for lack of training of doctors in mental health disorders.
So when you talk about the training, is this something that would be a part of their medical schooling when they're coming into the medicine world? Or is this something that's ongoing? Or is this more specific? Once you are a doctor in your field, you need to take this special training so you know what to do to identify
Yeah.
these
No,
specific patients.
you're identifying two segments of training there, Ashley. The first thing, answer your question, they should be trained not 2% of total training time. 30% of total training time in medical school and residency should be devoted to mental health. And it isn't like you said, oh, here's 30% for this and 70% for physical diseases. They would be integrated. They would always be integrated. Now, the same thing would happen through residency. They would then graduate. And again, we're not trying to create psychiatrists out of everybody. They would graduate, though. What we want is to be as competent in mental disorders as they are in physical disorders. In other words, I would be as competent taking care of depression or addiction as I am with diabetes or a heart attack. That is not now the case, but I would be. And the model of care then is the same as we now do. I would see them, primary care doctors like myself that are trained, can take care of most people with depression, anxiety, addiction problems. But when we fail or when things don't go right and so on, we would then refer to psychiatry. And we haven't mentioned this yet, but psychiatrists are in terribly short supply. They see only 12% of all mental health patients. And the fallacy, it's probably a fantasy more than a fallacy, but in medicine has been that psychiatry was going to take care of mental health.
Hmm.
And so when people take, this is now after medical school, some people, a very small percentage of medical graduates, it's like 4% is all, go into specialized training in psychiatry. That's where the 12% of psychiatry care comes from. They take 4 years of training, then they are specialists, just like a heart surgeon is a specialist in heart transplants, or like a diabetologist in diabetes. And so those are the specialists that the trained primary care doc like myself would refer to with problems. But we would skim off, as it were, the low hanging fruit of mental disorders that never would even have to go to psychiatry. Just like we now take care of most diabetes, most hypertension, most heart disease. But when problems arise or when a special technique is needed, we refer to the appropriate specialist.
That makes sense.
Yeah,
So then how do you respond to the argument that you might hear from doctors these days saying, well, we do notice when there's something off about our patient and we send them for a psych evaluation. I've heard that
yeah,
term plenty of times. So
sure.
I would imagine there are some heroes out there and there are people who are paying attention to this. And
Oh, yeah.
nurses are very in tune with patients, I know from experience. And so I'm curious how you respond to people who would say, well, I am paying attention. We are noticing. Maybe the training's not at the high level, but at least there's some of that, right?
Yeah, no, and there are people like I was in practice that start paying attention to it. And I then made many, when I was in practice, then made many referrals. Um, Although the problem becomes it's hard to get referrals. Remember, psychiatrists see no more than 12% of all mental health patients. Most counties, 50% of counties in the US have this many psychiatrists, zero.
Mm.
95% of counties in the US are judged as insufficient numbers of psychiatrists. So psychiatry tends to concentrate, as does psychology, in university towns and in fairly well-to-do towns in the north, particularly in the northeast part of the country. There is next to no rural psychiatry. They just
Wow.
don't exist. And this is why primary care docs like myself need to be trained. There's nobody there to refer to. And I mean, other times you talk to doctors, they say, well, there are a couple of psychiatrists in my town. It takes 9, 10 months just to get them in to be seen once.
Hmm.
And so psychiatry is not the answer. We do need more psychiatrists. I'm not anti-psychiatry, believe me, I love them. We need many more. And psychology. Psychology sees another 10, 12, 15% of patients. So if you add that together, psychology and psychiatry see about 25% of all mental health patients. That's where primary care docs like me see 75%. We see the rest of it.
Hmm.
Um, and to your question, and there are many heroes and good people that are working hard on this. They still aren't trained, and like I was in practice, don't know what to do with these things. But busy as doctors are, 10, 15-minute appointments, untrained, it's well known that they are missing most diagnoses. There are data to support this, and that when they do make diagnoses, they're usually wrong, and when they give treatment, it's usually wrong. And so they are highly ineffective, as you would expect, given complicated, difficult to learn mental health disorders. Um, and the thing just goes on and on from there. Um,
Well,
so
the numbers speak for themselves. You're painting quite a clear picture of what this looks like.
yeah, no, it's just awful. I mean, and they need to do something, but medicine isn't doing anything. And medicine knows about this, Ashley.
Mm.
People, I'm not the first one to say this.
Mhm.
I'm about the 700th. People have been telling medicine just what I'm telling you this since 1970s.
Yeah, I hear you. I hear you.
Yeah, and medicine just it's in one ear and out the other.
How do you give hope on this matter? I know it would take a massive amount of resources and influence to change this. So where does the hope come in? How is this possible?
The hope comes in that it can be changed. It can be changed.
Hmm.
People just aren't aware of it. This is why I'm writing the book and talking to you.
Hmm.
People simply aren't aware of what's going on.
Yeah.
Remember the Vietnam War? You may not. You're probably young enough to.
I know about
Yeah.
it.
Uh, the Vietnam War, the women's movement, the civil rights movement, same thing. People learned about that and changes occurred.
Yeah.
Let me give you a couple of specific examples of where a book came out, like Has Medicine Lost Its Mind, and changed a recalcitrant institution. Ralph Nader wrote Unsafe at Any Speed. The automobile industry at that time knew that seatbelts worked. They knew their gear shift organization was wrong. I mean, people would go think they're going backwards and they would go forward. And there were a host of other safety problems. They didn't do anything about it. They didn't want to spend the money on it, and they were afraid if they put seat belts in, people wouldn't use them and they'd cost too much. And so, for cost reasons, they just did nothing. Nader's book comes out, and the public got furious about how their safety was being jeopardized. Remember, it was Unsafe at Any Speed, is the title. That led politicians, the public, an inflamed public, got hold of the politicians. And that led to the formation of the National Motor Safety Act. That's not quite it, but something like that, which is why you have seat belts in your car today. When you buckle up today, it goes back to this book that Nader wrote. Rachel Carson, another book that had an impact on a recalcitrant industry, wrote Silent Spring. The chemistry industry at that time, chemical industry rather, was polluting everything it touched. It was so bad there was DDT in our drinking water. They didn't do anything about it. They knew it. It cost too much money. Public didn't know it until Rachel Carson's book comes out. People learned they're drinking DDT in their water. They were furious. They insisted then that politicians do something. And we have the result of that yet today. It's called the Environmental Protection Agency. I'm sure you've heard of that.
Yep.
That's where that comes from. And that shows that a book like Has Medicine Lost Its Mind can have a similar impact on the healthcare industry. And so there is hope in this. And it can be done. It works. But the people need to get active and get involved. Um, while we're talking about it, let me tell you about my website because it relates to this.
Great.
But it's Robert C. Smith, MD, and don't forget the MD. If you have just Smith, you'll never find me. There are too many of us. So it's robertcsmithmd.com. Once you click on that, the page that comes up, there will be a little square that says Act Now. That will contain a short paragraph and the email addresses of the president, the surgeon general, the National Academy of Medicine, your congressperson, and your senator will be there. Simply take that paragraph, plug it into those emails, and send it. The paragraph advises something we haven't talked about yet, but maybe we can if you want. But the paragraph tells what politicians need to do now to make a change take place.
I share with my clients and my listeners, awareness plus action equals growth or change. That's kind of my formula
Uh,
I base my work on. So
that's right. You're
your
a good coach.
thank you. But what you just explained was the awareness part. We've talked about what we know. You've
Yep,
explained the data, your own experience, and now you have the action button that you share
that's right.
as well. So there's the action, which I understand now. You can hopefully see some change in
Yeah,
this because you can. I love that you use the word can. We can make a difference. We just need to
yep.
be aware of it and do something about it.
That's right. And everybody, the more letters these people get, the more aware they become and the more likely they will do something. And it has to be done. There is hope in that. It does work. Remember Rachel Carson and Ralph Nader.
Yeah, great examples, truly.
And other examples, I mean, civil rights movement,
Yeah.
the Vietnam War. When the public gets involved, things happen.
Mhm. So speaking of the public, people listening now who want to believe that it's possible for this change, especially people who've been affected in this way, whether
That's right.
personally with themselves or a family member, loved one, friends, what kind of, I don't know, encouragement can you give to them? What do you feel like they need to hear?
Yeah, there are doctors out there who will be sensitive, and a way to encourage that. And again, doctors are not bad people. They simply haven't been trained in these things. So if you think you have a mental health problem, you're sleeping all the time, or eating too much, or not at all, or feeling depressed and blue, or anxious, or drinking too much, or taking too much marijuana, whatever it might be, if you think you've got a problem, go to your primary care doctor and be upfront about it. I'm feeling depressed. I think something needs to be done about this. I've lost interest in my work, or I'm doing poorly at school, or whatever it might be. And be upfront. People sometimes get intimidated by doctors because they're so busy. They hurry in and hurry out and so on. Doctors actually like to have you tell them what you want to talk about. It helps them organize and get organized. Otherwise, they're just kind of, you know, all over the place. And they've got their own things to ask about medications and blood pressure and stuff like that. But if you tell them what you're interested in and what you want to address. Now, if the doctor seems sensitive to that and understanding and takes some time, maybe prescribes an antidepressant, and some doctors have done very well at this. That's okay. On the other hand, if they seem nonplussed about it and say, "Oh, pull yourself up by the bootstraps," and so on, maybe you ought to exercise a little bit and slough it off. Or if they give you a low dose antidepressant and don't have you come back, because depressed people need to be followed up regularly to get onto the right dose and make sure everything is going okay, that they're not becoming suicidal. But if the doctor does that and follows that, then you're in good hands. If they don't, request a referral to a psychologist. Psychiatrists are hard to find. If there's one there, that would be okay. But psychology they don't give medications, but they do wonderful psychotherapy. And psychotherapy, sometimes it's called cognitive behavioral treatment, is very effective. It's as effective as medications, and patients often like it better. And so they can also tell whether you need medications, and they could then communicate back to your primary doc that you need to start on an antidepressant, for example. And the doctor and the psychologist then work together. The psychologist also would know if a psychiatrist needed to see the patient for medication adjustment. And so those are the things I would address in the current circumstance. But make sure if you think you've got a problem that you get to see someone who knows what they're doing. Now, if there's any question about you feeling suicidal, wanting to harm yourself, get in the emergency room right away. They will find somebody to help. And just some self-help things are also useful, but I don't recommend this as self-treatment of serious mental illnesses. But exercise helps prevent. Making friends, make sure you've got contacts, uh, talk to people, how you're feeling, get an ally, somebody that works with you. Journaling helps. And some people call it a diary, but don't just write about the birds and bees that you saw. Write about what's the most positive thing happened to you today and what the emotion was, and then what your behavior was as a result of that. Then write about the most negative thing that happened, what the emotion was, and what the behavior was. And there are a host of self-help things like this that work quite nicely. I mean, meditation, yoga, all of these things, exercise, all of these things help offset depression. But if you already have it, do not rely on these for treatment. You need professional help.
Yeah, that's fantastic. You went right to where I was headed, which was what can we do now? And
Yeah.
there's a lot of self-advocating in there, speaking up, asking
Yep.
questions, not being afraid
Yep.
of that. I love that you mentioned doctors want to know, guide us, tell us what you need.
Yep.
And that's huge, is just giving yourself a voice. But I love that you went into things you can do right now. Obviously, if there's something serious, get help. There are things you can do right now, which I really appreciate you mentioning. And that's kind of where I come in. I like to call myself kind of the bridge professional. I help people who are dealing with something get to where they need to go. And in my profession, I have often guided people and coached people towards psychology and mental well-being and
Exactly.
making those choices. And in fact, I'm really proud that my certification training, we went through an entire education on what to identify and what to notice when I have a client who needs to be referred to mental health care beyond me,
Good
psychology,
for you.
psychiatry.
Yeah.
So I'm really proud of that, and I've had to deal with that a few times.
Oh,
And
I'm sure you have. Yeah.
yeah. But it's good to know that there's more mental well-being and overall wellness becoming, I don't know, more part of the medical industry than just the self-help group. Like I know we could talk more about this for sure, but I know you've connected this mind and body. It's not just about getting the medicine you need, it's about preventative,
That's right.
taking care of yourself, and the meditation and the yoga. Like all those things really are powerful.
Yep. And they all go together. It isn't just one thing. A medication is not going to cure any underlying problem. This is where sometimes psychotherapy, coaching helps, like you do, is to understand why you feel the way you do. Abuse in the family, abuse when you were young. These kind of things are powerful effects that have their effect then later in life. They become manifest. Somebody's depressed or whatever, taking drugs. They often model off of what they saw as youngsters. Mother was an alcoholic, they become an alcoholic. And so it isn't enough just to take a medication. And this is the downside of psychiatry today. Psychiatry used to explore this. But now today, all they do is administer drugs. And don't get into this, and unfortunately fail to establish the relationships with patients that they did in the past, and which is the heritage, in fact, of psychiatry. That's where this all of this understanding of doctor-patient relationship came out of psychiatry, back from Freud at the turn of the last century. But they've kind of lost it. Psychology retains that, and so also should trained medical students.
I hear you. So let's put a bow on this. Not that you can, because It's a continued conversation. It's continued efforts. It's awareness and taking action and hopefully making the changes we need so
Yeah,
badly. So, final words. What is something that absolutely should be taken away from today and hopefully from your book? We will definitely mention all the information you need there, but
sure.
what are the last things we need to take with us today?
Hope. It can be done. Society can change. Society is powerful. As Hannah Arendt said, society needs to be involved in deciding what sciences like medicine do. We've already decided in genetic manipulation, we don't want test tube babies. We've already decided from strong societal input, we don't want to be run by robots. But medicine, the population doesn't know what's going on in medicine. That's what we're talking about. And there is hope. Be informed about how bad mental health care is. Go to your politicians. They will get something done. So there is hope.
There is hope. They are going to be able to find lots of this information in your book. I want to repeat your website, robertcsmithmd.com, and then remind us or tell us where we can find your book.
It's present everywhere. Book a Million, Bookshop, Amazon, Barnes and Noble. It's every place. It's on my website. If you go there, it pops right up, right with this little square that comes up. No, it's available all bookstores, and if the bookstore doesn't have it, the books just come out. If they don't have it, they could order it.
Fantastic. So wide and far, findable and potential for
Yeah,
influence. This is fantastic.
yeah.
Congratulations.
Yeah, thank you. And then people can follow me. All my social media is
Oh,
on my
let's do that.
website there. Yeah.
Okay.
LinkedIn, X, Facebook, you can follow me there
Fantastic.
to stay updated on this because we're very active there.
Yes, good. Absolutely. I really appreciate you being here today, Bob. You're doing very good work. I love that it's people focused and doing good. And we're big fans of doing good. I always sign
Yeah.
off with your needs matter because you matter. And I can tell after this conversation that that's part of your motto as well.
Oh, for sure. And thank you for what you're doing to raise consciousness to this problem. It's
Yeah,
very important what you're doing.
thank you. Agreed. Well, I will let you go and continue changing the world.
Okay. We'll do it together.
We'll do it together. I love that. Thank you so much.
Okay. Take care.
Thank you for listening to the Needy and Normal podcast. The show is brought to you by ABL Life Coaching. Go check it out at ablifecoaching.com and also find us on Instagram, Needy and Normal Pod and ABL Life Coaching. Accepting new clients come fall 2025.